Now we talk about free radicals. So, liver with brownish pigment lipofusion seen on cross picture can also be hemosiderin, bilirubin, etc. Therefore, need to have case with the cross picture and products of free radical damage are lipofusin because certain things are not digestible, include lipids. Defi talk about definition of free radical. It's a compound with an unpaired electron that is out of orbit. So this unpaired electron out of orbit. Therefore, it's very unstable and it will damage things. Types of free radicals. So oxygen. We are breathing oxygen and oxygen can give free radicals. If give a person 50% oxygen for a period of time, we get superoxide free radicals, which leads to reperfusion injury, especially after giving a drug which is a TPA when trying to rid a damaged thrombus. So oxygenated blood goes back into the damaged cardiac muscle, which is reperfusion injury. So kids with respiratory distress syndrome can get free radical injury and go blind because they destroy the retina. So called this retinopathy. Prematurity also leads to bronchopulmonary dysplasia, which leads to damage in the lungs and a crippling lung disease. Now, talk about water. Water in tissues converted to hydroxyl free radicals, leading to mutations in tissue. Complication of complication of radiation therapy is cancer. Most common cancer from radiation is leukemia due to hydroxyl free radicals. So iron 2 plus produces hydroxyl free radicals because of the Fenton reaction. This is what make iron overload diseases so dangerous because whenever iron is overloaded, leads to hydroxyl free radicals, which will damage the tissue. Therefore, in liver leads to cirrhosis. In heart leads to restrictive cardiomyopathy. In pancreas leads to failure and malabsorption along with diabetes. Now, talk about cell injury. Now, thì, now we talk about types of free radicals. First, with the oxygen, and then water, and now Tylenol. Tylenol, also known as acetaminophen, most common cause drug-induced fulminant hepatitis because free radicals, especially targets the liver, but also targets kidneys. Cytochrome P450 in liver metabolizes drugs and can change drugs into free radicals. Drugs are often changed in the liver to the active metabolite. For example, the phenytoin Whereas the liver does acetaminophen toxicity manifest itself right around central vein treatment and the acetylcysteine. How? Well, the free radicals can be neutralized. Superoxide free radicals can be neutralized with supraoxide dismutase. The SOD glutathione is the end product of hexopentose phosphation, and this also generates NADPH. Main function is to neutralize free radicals, especially drug-free radicals and free radicals derived from peroxide. Glutathione gets used up in neutralizing the acetaminophen free radicals. Therefore, when given N-acetylcysteine, also known as mucamist, you are replenishing glutathione. Therefore, giving substrate to make more glutathione so you can keep up with neutralizing acetaminophen free radicals like methotrexate and leucovorin rescue. Using up too much folate, leucovorin supplies the substrate to make DNA folate reductase. The next one talk about carbon tetrachloride, CCl4, can be converted to a free radical in the liver, which is CCl3, so in the liver, and the free radical can be formed out of that, seen in dry cleaning industry. So dry cleaning industry. Next one, talk about aspirin plus Tylenol. Very bad for kidney. Takes a long time for damage to be seen. Free radicals from acetaminophen destroying the renal medulla only receive 10% of the blood supply, relatively hypoxic, and renal tubules. Aspirin is a knocking off vasodilator prostaglandin 2, which is made in the afferent arteriole. Therefore, so angiotensin 2 is a vasoconstrictor is left in charge of the renal blood flow at the efferent arteriole, either sloughing off medulla or destroy ability to concentrate, dilute your urine, which is called anergatic neuropathy, due mainly to acetaminophen. So hypothesis. Talk about hypothesis. Program cell death. So apoptotic genes is a program to die theory. Normal function. One embryo small bowel got lumens from apoptosis. So two is the skin of the body with a Y chromosome for men. So MIF very important because all Mullerian structures like a uterus, cervix, upper one third of vagina are gone. So when Y chromosome is the king of the body, MIF, Mullerian inhibitory factor, this inhibit all the Mullerian structures like a Mullerian structure, uterus, the cervix, the upper one third of vagina is gone. Therefore, no Mullerian structures. So MIF is a signal working with apoptosis via caspases. They destroy everything. They wrap everything in apoptotic bodies to be destroyed, and lipofuscin is left over. Number three, for women, X chromosome only have one functioning, and the other one, because the other is a bar body. Uh, Absence of Y chromosome cause a terminal ridge to go to ovarian route. Therefore, hypothesis knock off the Wolffian structures. So Wolffian structures, so like epididymis, seminal vesicles, and vas deferens. So that's a Wolffian structure. But this one they knock off. So there's no Wolffian structures in the woman. So that's why they appear like a female. So absent of Y chromosome, the terminal ridge go to the apoptosis, so they knock off Wolffian structure. Okay, got it. In men, and men have a MIF, which is Mullerian inhibitory factor, so that they inhibit all the Mullerian structure. So in women, so because no Y chromosome, so they knock off the Wolffian structure. Wolffian, which is for male, and Mullerian, which is for female. So the thymus in anterior mediastinum, large in kids. If absent, cause discharge syndrome. Absenthymic shadow would also have a tetany, cause a thymus to involute is apoptosis. Apoptosis is a major cancer killing mechanism. Process of apoptophy and reduced cell or tissue mass is due to apoptosis. Process of atrophy and reduced cell or tissue mass due to apoptosis. Okay, for example, hepatitis, the consumer body looks like eosinophilic cell without apoptosis. So, individual cell death with inflammation around it. Jaundice, the signal hormone or chemical. So, hormone or chemical which activate the caspases and no inflammation is around it. So, hypothesis of neurons, lost brain mass or brain atrophy, and leads to ischemia, red cytoplasm, and pyknotic nucleus. So, atherosclerotic plaque. Therefore, hypothesis is involved in embryo pathology and knock off cancer cells. Okay. Now we talk about types of necrosis, manifestations of tissue damage, coagulation necrosis results often from the sudden cut off of blood supply to an organ. Ischemia, definition of ischemia, decrease in arterial blood flow. So in ischemia, there is no oxygen, therefore lactic acid builds up and leads to coagulation necrosis. So cross manifestation of coagulation necrosis is an infarction under microscope. Looks like cardiac muscle, but there are no striations, no nuclei private, no inflammatory infiltrate, all due to lactic acid. So that has a denature and destroy all the enzymes cannot be broken down. Neutrophils need to come in from the outside to break down. Therefore, wake outlines coagulations necrosis. Number one, pale and hemorrhagic infarctions. Look at consistency of tissue. So good consistency. Crossly look pale, which is infarct, like a heart, kidney, spleen, liver, regardless of the organ to infarct because due or blood supply, such as coagulation necrosis, example of the pale infarction of the spleen, most likely due to emboli from left side of the heart, cause emboli. So vegetation rarely embolize in acute rheumatic endocarditis. Infectious endocarditis, mitral stenosis, heart is repeatedly attacked by group A beta hemolytic streptococcus and clots and thrombosis. The worst arrhythmia associated with embolization in the systemic circulation is AFib because there is stasis in the atria, clot formation, then is a vibrate, little piece of clot embolize. The worst arrhythmia associated with the embolization in the system circulation is AFib because stasis of atria, clot formation, then it vibrates, little pieces of clot embolize. Now talk about gangrenous necrosis, dry and wet gangrene. Picture of dry gangrene. So not wet gangrene because there's no pus. Occurs in diabetes with atherosclerosis, polluted artery, and possible thrombosis. Dry gangrene related to coagulation, necrosis related with ischemia. Definition of ischemia: decrease in arterial blood flow, which is due to atherosclerosis of the popliteal artery. Pathogenesis: a myocardial infarction, coronary thrombosis overlying the atheromatous plaque leading to ischemia, and lumen is blocked due to thrombosis. Most common cause is a non-traumatic amputation, which is diabetes because of enhanced atherosclerosis, popliteal artery, dangerous artery. Coronary is also dangerous because small lumen, so that's a dry gangrene. In wet gangrene is complicated by infected heterolysis and consequence liquefactive necrosis. Now, lose a consistency of tissue, hemorrhagic infarct. Good consistent, which is look pale infarct, but lose consistency of tissue, hemorrhagic infarct, like a bowel, a testis. Sorry. So torsion of the testis, especially the lung, because it has a loose consistency. And when the blood vessel rupture, the red blood cell will trickle out, leading to hemorrhagic appearance. Example: hemorrhagic infarction of small bowel due to indirect hernia. Second most common cause of bowel infarction is getting a piece of small bowel trapped in indirect hernia sac. Most common cause of bowel infarction is adhesions from previous surgery. Example: in the lung, hemorrhagic infarction, wedge shape went to pleural surface, therefore have effusion and exudates. Neutrophils in it have a pleuritic chest pain, knife-like pain on inspiration. Pulmonary embolus leads to hemorrhagic infarction. Now talk about liquefactive necrosis. So exemption to renal coagulation necrosis in infarctions brain. Most common side of infarction from carotid artery, while we listen for the brute, hearing from the noise that is going through the vessel that has a narrow lumen place with thrombus develops over atherosclerotic plaque and leads to stroke, leads to transient ischemic attacks is little atherosclerotic plaques go into little vessels of the brain, producing motor and sensory abnormalities. that go away in 24 hours. Brain with the meshwork in brain astrocytes is analogous to the fibroblast because of protoplasmic processes. Therefore, actin-like fibroblasts cannot make collagen, but its protoplasmic processes give some structure to the brain. Therefore, inversion of brain basically liquefies it has no structure, and you see the space liquefactive necrosis. Therefore, exception to the rule of infusions not being coagulative necrosis is a brain and is undergo liquefactive necrosis. No structure therefore leads the whole cerebral abscess and all atherosclerotic stroke both are liquefactive necrosis. Liquefactive, liquefy, thin neutrophil because their job is to phagocytosis with their enzymes to liquefy. Liquefactive necrosis relates to an infection with neutrophils involved, usually acute infection, producing an abscess or an inflammatory condition which liquefies tissue. Therefore, the liquefactive necrosis usually applies to acute inflammation related to neutrophil damage to tissue. Exemption to the rule: liquefactive necrosis related to infarct, not an inflammatory condition. It just liquefies. Slide shows liquefactive necrosis due to infection of the brain. So if you infect the brain or have an infection or have an abscess, it's the same process with the liquefactive necrosis. Examples: abscess, uh, negative gram so positive cocci, absent gram positive cocci in the clusters. Why are they in clusters? Coagulates, which leads to abscesses with Staphylococcus aureus. So coagulates converts fibronogen into fibrin, so it localized the infection. So fibrin strands get out, result in the abscess. Strepsil, so releasing hyaluronidase, which breaks down GAGs in tissue, and infection spreads through the tissue cellulitis. From point of view of necrosis, neutrophils are involved, therefore it is liquefactive necrosis. Resemble abscess along the yellowish areas, high fever and productive cough, gram show gram-positive staphylococcus, which is a strep pneumonia, most common cause of bronchopneumonia, not hemorrhagic because it's pale, and plate-shaped necrosis of the periphery, which leads to pleuritic chest pain. Example: patient with fever, night sweat, weight loss. These are my This is tuberculosis, right? So which has a granulomatous cases necrosis, pathogenesis, pathogen uh, pathogenesis of the granuloma involve interleukin 12 and subset of help T cell and positive PPD. Okay, so maybe we stop here. So thank you very much for listening for my live stream pathology.